Hi, this is Dan Driscoll. I have been asked to talk about the clinical research and practice for IPSO at 30, and this is on behalf of the Clinical and Scientific Advisory Board. Let's see. So, the first question was, what are the top priorities in terms of developing and promoting evidence-based practice in the next 30 years? And our group came together with a series of bullet points, starting with management of behavior, including temper tantrums, severe skin/rectal picking, and psychosis. To date, there's little understanding of psychosis and how it's recognized and treated. Another point is good social care for adults if they move away from home. It's essential that they remain physically well and to have a life with choices and opportunities. How to achieve this and what difference might treatments for hyperphagia make to the requirements of social care. In addition, deciding which medications are the most helpful for each individual. This would be building on what's been done with growth hormone, results from recent studies on other promising medications, and we predict there'll be many advances in the coming years that promise to improve the quality of life for those with PWS and those that care for them. So priorities continued. We also need to develop a tool to capture hyperphagia in a holistic way. We need to change the course of the disease with early treatment. We need to evaluate and screen all the comorbidities and work with sociologists and build and update consensus documents on evaluation and treatment compiled from international experts. And as many of you know, we've already have a first draft out on infants, children, adolescents, and adults, and we'll be continuing to update these with input from people around the world in the coming years. Question number 2 is, what do you consider the top challenges in terms of developing and promoting evidence-based practice? So at present, we do not have an agreed understanding of the complex interactions between biological vulnerability and environment that results in mental ill health and problem behaviors in people with PWS. Further, there is no comprehensive guidance available directed at optimizing mental health and well-being based on the above understanding, and there's also few clinical trials of interventions. Good mental health and well-being is dependent on informed support. How do we support parents? And then in adulthood, how do we support paid care providers to ensure that such support is provided? Furthermore, the cost of care, particularly when it comes to medications in low socioeconomic status countries, are an issue. The challenge will be to prove that treating people with PWS with appropriate medications will be a cost that's offset by lowering medical costs for their other medical and social issues, and further diminished if they can be a more contributing member of society. Question number 2 continued, top challenges. We need to find biomarkers for the severity of the disease and nutritional phase that person is in at that particular time. We need to have treatments which allow food autonomy, and we need to have early identification of families with less capacities to cope with the disease and support them more strongly. We need to have centers with multidisciplinary teams in all countries that have national organizations, and work closely with experts in intellectual disability and rare psychiatric disorders. There are lots of confounding factors and difficulties to develop robust evidence-based practice across the world unless we have big multinational studies which are performed. Question number 3 was, should IPSO contribute to developing and promoting evidence-based practice? And if so, how? Well, first of all, IPSO has a strong international network, and the international conference that's every 3 years remains a key occasion bringing experts, parents, and families together from across the world. IPSO is in a unique position to identify key issues, bring people together, and either initiate in partnership with others or lead on the development of best practice, and that evidence-based practice is applicable globally. We can also promote evidence-based practice through workshops, conferences, and the IPSO ECHO program to disseminate these findings. Question number 3 continued about evidence-based practice. We need to partner with local support and advocacy groups to educate stakeholders on the effectiveness of care of people with PWS and working to make that care more affordable. We need to facilitate exchanges between expert groups in the world and provide internet teaching and discussions. And then at this point, I'd like to remind everybody in a year, we have our international meeting coming up in Limerick, Ireland in July, and I hope to see you all there. Thank you very much.